It's almost November, and that's when we recognize National Prematurity Awareness Month. Every year, an estimated 15 million babies are born prematurely and in need of the very best care. Penn State Children's Hospital is the only Level 4 designated NICU in Central PA. Here to tell us why that designation is so important is Dr. Dennis Buse from Penn State Children's Hospital. Why is that level? Why is being a Level 4 so important?
Well, good morning. Maybe it's helpful to explain what a Level 4 NICU is.
Please do.
Where there are 4 levels, 1 through 4. Level 1s are your basic healthy baby regular nurseries. Level 2s, sometimes called special care nurseries, take care of babies who might weigh more than 3.5 pounds or be more than 32 weeks and don't really have any medical problems. Level 3, and there are quite a few of those around the mid-state, are much better equipped to take care of premature babies of any gestation and size, and they offer quite a few services. Level 4 takes care of all of those babies, but in addition has other specialized services that may not be present in them. It's important for us to understand that so babies can actually receive the care in the most appropriate place, and parents can actually make informed decisions about how to advocate for their babies and their pregnancies.
Talk about some of those services, because I do hear sometimes about babies locally being transferred to Penn State Children's Hospital because, you know, obviously prematurity most often is not expected, and it happens, and then they go to their NICU in that hospital, but they have to be taken to Hershey then. So what other services do you offer?
Sure. Well, we have all forms of help for breathing for babies, all forms of ventilatory help. We go beyond that. Sometimes lungs are too sick to be used even with a ventilator, and we have the capability of doing something called ECMO or heart-lung bypass for babies. That's a very specialized service. But beyond that, we actually have all manner of specialty services like neurologists for babies with brain issues, cardiologists. What designates us as a Level 4 would be some of the surgical services that we have, very specialized. We do cardiac surgeries for complex congenital heart disease and all sorts of other surgeries that typically aren't offered in the nurseries around us.
It is incredible what you're able to do and the lives you're able to save now, and you're actually embarking on a project. You're expanding that NICU for 2020. What's that going to be like?
We're very excited about that. A year from now, we'll be in a brand new, spectacular space. We're moving from our current 42 beds to 56 beds. And we'll have the capability for parents to stay with their babies in most of those rooms, which is going to be a big upgrade. And more importantly, the facilities will be first class for these families.
There's a lot of heartbreak, I think, in what you do, and a lot of for families. You know, it's a very, very tough time, an emotional time. For you, though, what is the most rewarding part?
Obviously, the babies and the families come first. What we do in the NICU is right at the very beginning of a new person's life. And if we get it right in the NICU, it has such important implications for health and development down the road. So what we do hour by hour in the NICU can actually matter years and decades later. The other very, very important rewarding thing for us is working with the families. As you said before, nobody really plans at the beginning to have a baby that needs to be in the NICU, but we're so happy that we have the nursing and the specialists and the equipment and the environment to take care of them and to get those families through a really rough set of waters is very, very helpful.
It is a beautiful thing. I'm so happy it's here, and thank you for what you're doing for families, not even in our area, but from out even beyond our area. Thank you so much, sir.
Thank you.